Welcome. Welcome, folks. We're going to get started on time. Close the store. Thank you for joining us. And those of us in person are going to be eating a lot for lunch, just giving you a heads up. And those of us online, thanks for joining us online. My name is Fiona Miller, and I'm the director of the Collaborative Centre. But I want to start by just acknowledging where I am here at the University of Toronto, that these are the lands that have, for thousands of years, been the traditional homes of the Huron-Wendat, the Seneca, and more recently the Mississaugas of the Credit. Today, Toronto is home to many, many diverse Indigenous peoples from across what is now Canada, what we call oftentimes Turtle Island. And one of the things that I reflect on here is that these are, and I think it's important to acknowledge treaty, because we are all treaty people. We are all, if there is treaty, we are all obliged to uphold treaty. So on the one hand, that these are lands subject to a colonial treaty, Treaty 13, or the Toronto Purchase from the early 19th century, but these are also lands, more importantly, that are subject to a pre-colonial treaty that are part of Indigenous legal traditions. So these are the lands of the Dish with One Spoon Wampum Belt Covenant Agreement between the Anishinaabe and the Haudenosaunee as a way to live together as one spoon in one dish. And these are, of course, the lessons that I think those of us engaging in climate change, planetary health, One Health, ecosystem health, political ecology of health, all of these issues are really trying to learn from and make sense of and enact, although we don't do that particularly well. So as I say, I'm Fiona Miller. I'm a professor here at the University of Toronto, and I direct the Collaborative Centre for Climate Health and Sustainable Care, which is a multi-faculty academic unit, relatively new. We're less than 2 years old. So really trying to find ways of supporting our community and building our community. One of the things we like to do is to work in collaboration. So I'm really pleased that today this seminar is being put on by 3 institutions, both the Collaborative Centre here at U of T downtown, as well as the Dadalay Institute for Global Health Research, which is at York University and has been around for quite a while and has a theme group on planetary health doing amazing work. And also here across U of T's vast campuses, University of Toronto Scarborough, there's the Institute of, I have to take my notes, Economies and Sustainable Livelihoods, really trying to create work at the intersection. So we're working together, we're collaborating together to put on these types of events. So really pleased to welcome you. So this is actually the second in a critical conversation series as we work to create space for tackling some of the deeper issues. There's lots of, improvement work to do, I suppose, that takes on some works with existing institutions, works with existing norms and practices, but clearly that's not going to solve climate change or the global ecological crises that we're facing, which are connected with deep sociopolitical forces and factors. So super pleased to be able to welcome Martin Hensher here, Dr. Martin Hensher. He was in this hemisphere, and we were able to leverage that to bring him on a short hop from New York as he's doing some great speeches and talks around. So Martin, and I have to read this, is the Henry Baldwin Professorial Research Fellow in Health Systems Sustainability at the Menzies Institute for Medical Research at the University of Tasmania, the university at the end of the road, at the end of the world, to channel Anna Singh and her mushroom at the end of the world. That's a bit of a non sequitur comment there. But Martin is that extraordinary intellectual who is working at the intersection of disciplines and really pushing the envelope. So as a health economist, also deeply engaged with ecological economics and necessarily, I think, therefore, heterodox economics, the non-neoclassical economics that is regnant with us today. So with that as a too long preliminary, I'm going to hand it over to Martin to take it away.
Thank you, Fiona. And yes, maximum points for getting my job title right. The usual stumbling point. So I thought, in the words of the talking heads, maybe how did I get here? That might actually help because I've had an atypical path to end up as an academic. So I kind of started off via the British Army and the National Health Service in the UK, and then moved into health economics, which gave me extraordinary opportunities to work in some really fascinating settings. I spent several years really crawling around the wreckage of the Soviet Union, trying to help people put things back together after the initial wave of privatizations and everything that happened there. I found myself with an extraordinary experience of 6 years in South Africa between 1998 and 2004, where I had the real privilege and challenge of working there during the peak period of HIV denialism, but at the same time as we were actually bringing into play antiretroviral therapy, as the HIV/AIDS epidemic was really turning into a massive source of death and illness at that time. And then I went back to the UK, where I worked as a civil servant, and for reasons far too complicated to explain, ended up then in Tasmania, Australia, where I worked in the State's Department of Health in Tasmania. And somewhere along the way, I guess, from early experiences in working in very resource-constrained settings to returning to working in the health systems and government systems of very rich countries, somewhere perhaps in the early 2010s, I began to ask myself questions about what are we really doing here? Are we really prepared as health systems for some of the obvious pressures, particularly climate change, but other kind of ecological, social pressures that we've all really been seeing since at least the global financial crisis? I guess they've been sort of manifesting themselves. And probably not intuitively, my response for that was to do a PhD. Really, actually, because I was chatting to a colleague while I was still a public servant. I was chatting to a colleague and said, I've got all this stuff I want to write about this. And she said, why don't you come and do a PhD? It's free. And that was that kind of got me finally, having evaded a PhD for most of my life until that time. I did my PhD part-time at the University of Tasmania, and then was able to jump tracks from government to academia, first by way of Deakin University in Melbourne, and then back to Hobart, Tasmania, where I now am in the Menzies Institute. And really, I guess the question I was asking myself after, 20, at that sort of stage, 25 years in health economics and mainstream economics and health policy, my real question to myself is, why are we not talking about what all these threats, ecological and otherwise, these threats to the sustainability of our healthcare systems, why are we just not talking about this? And that has led me down this rabbit hole into heterodox economics, particularly ecological economics, and continuing to apply that to, for me, probably healthcare more than health, but one has to straddle obviously health and healthcare. So that is kind of talk a bit about that today. But I'm going to be talking today about post-growth and degrowth. So first of all, apologies to anybody. If any of you did see my talk on Wednesday, there is going to be a bit of overlap initially, but I promise you we will quickly move through that. But there's just a little bit of kind of the same setup, but then we'll actually cover some fairly different material further along. So clearly, can't quite see in the room, you can't quite see the title, can you? But economic growth has been the kind of driving force of our economic model for at least 200 years, particularly in even today, our governments all around the world remain deeply committed to economic growth. Economic growth is a relatively recent phenomenon, really at large scale for most of human history that we can have a go at coming up with economic records for. It sort of bumped around a bit. It went up and went down depending what was happening. But suddenly in the 18th century, perhaps maybe the 17th century, something started happening and we went on this kind of exponential growth course, which has led to a massive expansion in human economic activity. And we'll talk a bit more as we go through, but obviously GDP, gross domestic product, is we measure it in money terms, but particularly through much of history, it also reflects obviously our consumption of stuff. stuff, our consumption of material resources, natural resources, etc. So it's highly correlated, GDP, with our ecological footprint on the planet. And along with economic growth, coincident with it was a sudden change, or not sudden is not the wrong word, but a very marked change in human life expectancy. So again, from the best data we have, sort of in the more recent period, we've got data, life expectancy data for England, which goes back several centuries, which is reasonably accurate. And you can see here the sort of the pink curve that was bumping around 40 for several hundred years. But then in the mid kind of 19th century, something starts to happen to life expectancy in England and then in lots of other countries too. And of course, the thing that initially happened was infant mortality started to go down dramatically as a result of all the things we understand, basic public health measures, better nutrition, et cetera, et cetera. But we've had a huge change in human life expectancy, and obviously, along with life expectancy, all sorts of other health factors. Now, healthcare has also been transformed completely in this period too. So here's a surgeon, circa 1638. Very different scene and a very different setting, but there's a lot going on there. Of course, obviously enormous changes in technology, in the complexity of what they're doing, and also in the levels of kind of professional training of everybody in all of the pipelines that are delivering what's happening to that patient in that operating. Here's the first New South Wales ambulance in 1895. And even in 1895, I was fascinated to see they actually had an emergency phone line you could call in Sydney if in case of accident. If you look in the right on the sign, there's a telephone number for you to call. That's pretty good. And here's one of our Ambulance Tasmania Bell helicopters. Now, look, you don't usually get the helicopter turning up to your house, but we actually have a few of them. We cover a big area, and we have several ambulance helicopters. In that helicopter, obviously you've got a pilot flying it, but in the cabin you've got an intensive care paramedic who will have at least a master's level training in intensive care paramedicine, as opposed to the gentleman here whose main job was controlling the horse and a bit of, I don't know how they did first aid in 1895, but some 1895 style first aid. So again, it's this sort of extraordinary increase in not just the technology, but the complexity, professionalization, specialization of everything across our society, but particularly in healthcare, which is this sort of hallmark of modernity. Healthcare spending, this is an important chart to think about. Now, this has been the US, and we all know that the US is not necessarily the healthcare system you want to copy. But in fairness to these authors, so Catillon and co. did a fantastic job. They went back through Massachusetts state data about medical expenditures in Massachusetts, and they were able to track this data series right back to 1800. So they're looking here at medical expenditure in Massachusetts as a percentage of gross state product in Massachusetts. So you can see there, so kind of beginning of the 19th century, 2% of economic activity, which is what GDP is, was medical care. Not surprisingly, because obviously, there was a limited amount of things we could do for you at that stage. And that slowly creeping up kind of over the 19th century, getting up to 4% maybe by the Second World War. But then this extraordinary thing, kind of sometime, I guess, at the end of the 1960s, it has this extraordinary acceleration, taking it up from, 5% up now to 18%, which is where it sits. So, it is remarkable. If you think about America, 1/6 of the economy care. That's what that means. One in every $6 in the US economy is somehow kind of coming through the healthcare system. So, Canada, Australia, UK, etc., more down at the 10% level. But I reckon that kind of shape and sort of how that share has evolved is probably I'd be very confident it would be pretty similar in all of the high income countries. So that's very interesting, isn't it? How has healthcare, obviously, as the economy grows, healthcare might get bigger, but why has it got so much bigger as a share of things? Maybe can I ask you to hold? I'm very happy to do questions at the end. Otherwise, we kind of, I'll lose myself. So that's very striking that healthcare has become such a huge portion of the economy now. So growth. So it's all been about growth. The only inconvenient thing, or two inconvenient things, first of which is that actually global economic growth has been on a steady downward path, the rate of growth, since the Second World War, more or less. So every decade, or certainly since 1960, every decade, the rate of economic growth has been coming down. So this is the OECD countries, but even at a global level, that's true. So actually, for all that politicians are always banging on about growth and reigniting growth and whatever kind of particular slogan variant you have, they're in some ways, leave aside any of my ecological economics, heterodox economic stuff, they're kind of pushing on a piece of string and they're not really going to succeed because there's a very clear secular downwards trend in economic growth rates. As well as the nasty suspicion that the consequences of economic growth are now starting to catch up with us. So particularly the ecological consequences. Most of the pictures here are more related to climate change, but all there, of course, all the various ecological impacts across different dimensions, and then all the kind of destabilization that we're beginning to see around that globally. So are we now kind of entering what some have called the age of consequences? So that led really quite a long time ago now, 50 plus years ago, led people to start thinking about is our kind of standard kind of neoclassical economic growth model really the right model? Does it really describe the world as it truly is? So Herman Daly, who's one of the founders of ecological economics, kind of came up with what, once you've heard it, is a blindingly obvious insight, but actually at the time was a very striking insight. So he was a neoclassically trained economist, and he observed that actually in the way we conventional economists look at the world, we do actually think about nature. We think about both kind of ecosystems and natural resources and stuff, but we have a name for them, which is the natural resources sector, which is one sector of the economy like everything else. So natural resources, like, shipbuilding, like healthcare, it's a sector of the economy from which we extract resources. We dig stuff out of the ground and chop down trees and things, and into which we dump waste and pollutants. So conventional economic thinking doesn't actually ignore the natural environment, but it puts it in a very sort of subsidiary place as a sector of the wider economy. And Daly's insight, which is pretty straightforward if you're a normal human being, was that that's completely the wrong way around. We live on a planet which is, in the widest sense, an ecosystem, and we humans are not the only things on the planet, and our economy is only one subset even of kind of human things and human activities. So the economy is a subset of the ecosystem. And yes, absolutely, we take resources out of the ecosystem and we dump resources back in. And that's not a bad thing in itself. That is what life does. Life takes resources out of the ecosystem and waste comes out. Otherwise, you're not alive. And for a long time, that was okay because not so many humans lived in a very big world. So essentially, there were not many of us, and we had a sort of fairly empty world. But once we had that exponential growth, and of course, we didn't just have exponential growth in the economy, we had exponential growth in the number of us as well, from a million to 8 billion in pretty much 200 years. We have increasingly filled up the world with us and our stuff. So Daly called that the kind of the full world. And that, of course, begins to become a problem because then you are at risk, obviously, of overshooting, of being in excess of the actual ecosystem carrying capacity. So the sort of basic ecology insights into how all of this stuff works. And if you think about this, we've got, if you think about mammals on the Earth by mass, so kilograms, 34% of mammalian biomass is us humans, 62% is our livestock, and the remaining 4% is wild mammalian mass. Now, lots of those wild mammals are very tiny, obviously, but that is a sense of, how we have filled up the world with our stuff. And perhaps unsurprisingly, hopefully people have seen the planetary boundaries approach. This is hot off the press, their latest update that just came out the other day. So as a consequence of what we're doing, of all our use of resources and pollution, etc., we're now overshooting 7 of the 9 planetary boundaries. 4 of them, we're now in the high risk, definitely in trouble area. The other 3 were in the kind of increasing risk areas. So all of this activity pushing us beyond these planetary boundaries with the obvious kind of unknown but logical consequence of what does that mean for the sustainability of human life and all other life going forwards. And I won't spend too long on these. If people have seen the Kate Raworth donut economics concept, this data is a bit old now, but people at University of Leeds have got a fantastic sort of data set where you can go and put in your country and it will pop up your donut. And they like to compare, kind of the default comparison is with Sri Lanka, which is a country which is, at the time they did this, was not transgressing any of the ecological boundaries and was sort of, but of countries that were not transgressing ecological boundaries were doing relatively well on meeting the social needs of people, which is the middle of the donut. You can see they've got lots of red in the middle, which means that they're actually not meeting a lot of basic needs of people. Here's Canada on the left, doing pretty well, but not completely blue in the middle. A couple of, could do better. So their employment's a bit iffy. I kind of argue with them about that one. But like Australia's even worse, you'll be pleased to know, just a horrible ring of red around the outside on the ecological impacts. So that then led Daly, an ecological economist, to think about this concept of what Daly called uneconomic growth. So his idea was, we've got economic growth and we're still having economic growth. The economy is getting bigger and bigger. We are doing more stuff and using more, consuming more resources. So the economy is continuing to grow. We have always assumed that on balance, economic growth is a good thing, and that as the economy grows, people become more prosperous. That's good for them. However you want it in neoclassical terms, their welfare improves. But he floated the idea of, well, the economy can continue growing, but of course, is it actually possible that as the economy gets bigger, all of these harms that the economy is doing, ecological, but also various other kind of social harms as well, is it possible actually that you can start that growth can start to do more harm than good. And so his concept of uneconomic growth, very straightforwardly, is you can reach a point, which is the big blue vertical line in this diagram, where your economy is indeed still growing, but the net harms are bigger than the net benefits in terms of human welfare. So you're actually eventually your economy is kind of becoming counterproductive, basically, as you continue to grow. And I found that a very helpful concept, which we'll talk a little bit coming back to health and healthcare. If you think back to that GDP, healthcare share of GDP graph, healthcare has gone off like a rocket. So does healthcare potentially display these kind of counterproductive features of uneconomic growth too? So ecological economics then, compared to neoclassical economics. So in neoclassical economics and health economics, which is a branch of welfare economics within the neoclassical frame, that standard economics is all about the study of the allocation of scarce resources amongst unlimited wants. That's the Lionel Robbins sort of classical definition. But it's not the only concept of what is economics. There are others. A very powerful, different way of thinking about economics comes from feminist economics, which is that it sees actually the economy is really all about our social provisioning system. So neoclassical economics focuses overwhelmingly on the market and what is in the kind of market part of the economy, whereas feminist economics obviously says we've got all kinds of other economic activity which is outside the economy, particularly all the work of caring, etc. And that's all, everything, both the market and the non-market stuff, is all part of how we provide for our needs as a society, a social provisioning system. Ecological economics kind of takes that one further step, if you like, and absolutely takes that social provisioning idea, but really says that, so an ecological economics is actually about three things. It is first about talking about what is the sustainable scale of the economy. So just literally, how big can your economy safely be? So think back to those planetary boundaries things. Actually, how big can your economy be before you start getting in trouble? Secondly, how can you distribute those resources fairly? Because one of the big kind of tricks of growth economics is, for a long time, it sort of got us out of trouble of the kind of redistributional work that maybe we needed to do, because as long as everybody could keep on getting a bit more of the expanding pie, it could take some of the pressure off redistribution. And then thirdly, it is still about the efficient allocation of resources. So one of the reasons I think I'm been drawn to ecological economics is because it is actually, it doesn't kind of renounce a lot of what I've spent my career doing, which is thinking about what actually is cost effective. How do you run your services efficiently? You still have to do all of that, but you'll have to do all of that in this wider context of a sustainable scale and a fair distribution of efficiently used resources. So that's kind of ecological economics. And ecological economists, some of them love things like modern monetary theory, some of them don't. I'm very agnostic about all of that stuff. I think there are strengths and weaknesses in some of this stuff. But this is where we're going to go in a different direction from the other day. So you're going to try and keep on moving this reasonably fast. So within ecological economics, of course, like all good disciplines, it's already got all sorts of subspecialties, as we should. And obviously, one of the areas people focus on is macroeconomics. So ecological macroeconomists are very focused on this sustainable scale question. So they're trying to look at it kind of empirically, how big can the economy safely be, and B, how do you then run your macroeconomic policy to get you to or keep you within that kind of safe scale? So that kind of involves lots of interesting questions. So this big question of, has economic growth actually already tripped into uneconomic growth? Discuss. Can or should growth continue? And we won't take the kind of hour-long digression on decoupling, but essentially, if we could decouple our economic activity from material resource use, so if we could stop burning fossil fuels and not dig so much stuff out of the ground and recycle everything, theoretically, if we could decouple, perhaps we could continue to grow the dollar value of the economy whilst actually using less physical stuff. Okay, so theoretically, you could do that. But that, of course, all depends on, can you actually dematerialize the economy? So can you actually keep the economy going without using the sort of very high rates of natural resources that we currently do? And that is, of course, a huge barney between people in different camps. I mean, very few ecological economists would actually argue that we can achieve that decoupling, which is why we're going to be talking about postgrowth and degrowth, but it's a live debate. If we could dematerialize growth, then we could potentially have what they call green growth. And green growth is really the default stated policy of many, I say most, but many countries now, certainly Canada, Australia, Europe, etc., which is, yes, we're going to decarbonize our economies and everything, but we will continue growing. So that's the kind of, that's the default economic policy setting. Obviously, Donald Trump is taking the US in a different direction, but that still is the kind of default setting globally. And the Sustainable Development Goals are explicitly predicated on green growth. That is kind of an explicit part of them. However, if we actually don't think we can safely achieve that dematerialization, then we're in trouble. So then you might need to do something else. And you've basically got two options, one of which is stop growing the economy, which goes by various names, but is mainly kind of most popularly known as a steady state economy. Or if we're already in trouble, so think about those planetary boundaries, actually, if we're already in trouble, then we need to start heading back into the safe zone. Maybe we need to shrink the overall scale of the economy, particularly the overall scale of material, what they call material throughput. Okay, so those two, steady state economy and degrowth, both kind of sit uneasily in a catch-all term called post-growth, which is a bit of a slippery term, which has been invented because some people react very badly to degrowth, but kind of sits across both. But, and this again is something we don't like to talk about, why are we doing this? Well, because if we don't sort it out, we do actually risk kind of some level of collapse, or what is at least called involuntary degrowth. And I mean, I think kind of the extreme end of kind of civilizational collapse and human extinction and stuff, I think is pretty unlikely. But could we manage to kind of pull the Jenga blocks out and collapse a lot of what we built in modernity? Absolutely, if we do the wrong things. So that, I think, if you like, my primary motivation increasingly actually is about avoiding those worst outcomes, and that's what drives me in a lot of my work. So spend a minute on, without getting overly philosophical, but there's lots of different competing ideas at the moment about kind of these pathways to the future. And I think it's just worth kind of pausing on these, some of which are not typically in the kind of environmental debate. But this table just tries to show, so on the left-hand side, we've got some idea of economic growth and material throughput, and really three options: that we could decelerate our use of material throughput, we could kind of decouple our use of material, think about the decoupling, can we achieve that? Or we could continue to accelerate our use of material throughput, etc. And then on the horizontal axis, I mean, this is not kind of a line, but it's like different categories, if you like. We have everything from kind of people who suggest that we actually do not need to be bound by the natural environment. We are humans, and we can actually go beyond and control the environment, or maybe we need to accommodate the environmental stresses we caused already, or maybe we will be overwhelmed by what we've already set in train in the natural environment. And in this space, we've got a lot of things going on. So, you've got in the middle there, kind of towards the right-hand side, we've got green growth, steady state, voluntary degrowth, which we've already talked about. But those are not in isolation. So if you look up at the top left, we have, primarily located in Silicon Valley, we have a bunch of people with enormous amounts of wealth who are highly committed to this idea really of actually transcending some of them are quite explicitly transcending our human bodies and, into spaces like transhumanism, where we're going to be uploaded into the cloud, or cyborgs or whatever. Yeah, they're spending a lot of money on it. They are. And, your Elon Musks, who we must go out to the stars and find the asteroids and things to get over the environmental constraints. The AGI, artificial general intelligence people, it's, the AGI will take over and everything will be amazing. So we've got that kind of stuff going on, which is really quite extreme ideologies in their own ways, but kind of located in just the wrong place and point in history where they could potentially make a big mess. We have people called eco-modernists who are perhaps a bit less kind of extreme than some of those accelerationists, but they are deeply committed to technology will be the solution. So for them, technology will be the solution to the ecological crisis, primarily by actually controlling the environment. So most obviously through things like geoengineering, to reverse climate change, but we must push through. And they're all in this accelerate box because we just have to double down, and they're all got variants of we can continue to burn fossil fuels because if we don't, we won't be able to get the technological breakthroughs to sort it out. On the right-hand side, I've got denialist capitalism. So that's the real, like I say, that's not even the default policy, but that's the reality of let's just continue pulling fossil fuels out of the ground, et cetera, et cetera. And they're in the overwhelmed by the changing environment, because if we carry on doing that, it is all just going to go badly wrong. Then so down in the bottom right, beyond these kind of voluntary degrowth, we've got a kind of collapse trajectory, which like nobody thinks is a great idea. But there are people who do, in their hearts of hearts, and you come across people who actually believe the answer would be we all need to go back to kind of, hunter-gatherer, much more indigenous styles of life. And yes, it's very awkward that will only sustain a global population of about 100 million people, but that's a price worth paying. So there is a kind of quite hard kind of undercurrents in some sort of deep ecology circles as well. So I sit in the middle. I have spent most of my career, crashing around somewhat ineptly, but trying to really stop people from dying prematurely. And I think that's a very reasonable goal to continue with. So how do we keep protecting people's health in this very hostile environment? And yeah, I won't kind of dwell on this, but these accelerationist ideas come together, frankly, in quite nasty combinations that I think we're beginning to see even in the last couple of years. We're beginning to see much more clearly, particularly in your southern neighbour, some of these things really bubbling up in quite explicit ways. Obviously, the kind of death cult kind of violence stuff, but also really quite explicitly eugenic ways of thinking about what lives are valuable and what who is not, kind of, and damn the consequences. So I think that is important just to bear in mind. So, quick word on green growth. So, kind of, I don't mean this in a pejorative way because I'm very much working in the sustainable healthcare space, but most of us who are working in sustainable healthcare, doing sustainable healthcare things with, health systems as they currently are, we are working under a green growth paradigm because, as I say, that is the kind of government which is letting you do sustainable healthcare policies is almost certainly signed up to some version of green growth. So we need to be aware that that's the paradigm we're working in. And that's fine. So we understand all the stuff about sustainability. We need to reduce the carbon footprint of healthcare itself and all the many ways of doing that, reducing its ecological footprint. I think the question that becomes for healthcare, as for everything else, is there's a lot of other stuff we need to do to make healthcare systems sustainable, like reducing overuse, this sort of perennial is the wrong word, isn't it? Sort of slightly intractable problem of antimicrobial resistance, the impacts of wider overconsumption of other things that make us sick, which then put pressure on the healthcare system, and the basic fact that we still have several billion people who don't have anything like adequate access to basic healthcare. I think I'm very unconvinced that continuing with the growth model of green growth will really get its head around some of those things, particularly the kind of reducing overuse and wider overconsumption. I'm not so convinced of how we'll do that in a green growth model. So then that leads us to these post-growth ideas: steady state, degrowth, then come back to involuntary. So steady state economy is defined like this. So the steady state economy is one in which it has constant stocks of people and products. So somehow we kind of sit at a fairly constant population and we use a kind of constant level of stuff. And we maintain that with the sort of the lowest level possible of material and energy throughput. And the idea then being that you find that there's some point of balance where we can keep this going in an economy which has high levels of human well-being and health, but with the lightest kind of ecological touch at a level that can be sustained kind of indefinitely. I mean, forever is a big word, but like for a long time. So that's the steady state economy idea. And then degrowth. So degrowth is a contested space, as I discovered. I wrote a chapter there's a Rutledge handbook of degrowth, which is open access. I took the Faustian pact of agreeing to whatever AI use I had to agree with to let them do it, but the chapters are all open access in it, so it's actually quite nice. You can find that quite easily. So in degrowth, so most kind of, let us say, degrowth advocates, so people who are kind of real actively behind the degrowth idea, tend to like to talk about it as really being about how do we satisfy everybody's basic needs through light ecological footprints, and that really that's all about a transformational change, which is about what we really value, moving from what they call kind of economism, this growth-based, we must have more stuff, to actually things like conviviality, autonomy. It kind of requires quite big cultural changes in how people think about their well-being. I don't disagree with any of that, but I do sometimes think there's a bit of evasive action going on there about the fact that that does still reflect the fact that we are actually going to need to shrink parts of the economy, and that there's a lot of quantitative stuff that will have to be dealt with in that space. But then if you have thought about the steady state economy, obviously the way I've described it, that's a very hypothetical. There is some kind of equilibrium point that we can get to. Degrowth is, I think, one way I think of explaining kind of more plausibly is the end goal is a steady state economy, but to get to that point, particularly in high income countries, maybe we need to reduce material consumption to get there, even as actually material consumption might need to rise, particularly in the lowest income settings, to get to that kind of overall global point. And that therein lies one of the biggest challenges, really, which is that this is very difficult for one country to do. And even if you could, as one country, if everybody else isn't doing it, it's not going to really work out. So we'll maybe come back to that. So both these kind of steady state economy and the planned voluntary degrowth, this is, I guess, where somebody like me comes in, and why I fight constantly with my degrowthy colleagues is because I've spent my life as a bureaucrat, planner, economist, and I think we should get the spreadsheet out and work out and prioritize. And they were, no. So, but clearly, if they want to do this, there's going to be a whole lot of planning, a whole lot of reform across all domains, and a whole lot of reallocation of resources to do this, to mitigate the risks of it all going wrong en route. The biggest risk to all of this is we could, the best will in the world, we could set ourselves on a degrowth path. If we screw it up, the kind of the neoliberals back to growth people will win the next election, and it's all over. So kind of the lots of feasibility problems there. Whereas, as say, this involuntary degrowth, so let's call it kind of something from kind of decline to collapse. That's an unplanned thing that we don't want. It's unambiguously a bad outcome, but we have to be prepared for it. And, again, I think something I bring from my past history is you always have to have an exit plan and an exit route, and we need to be preparing for what if it doesn't work out. This is the thing that people really don't like to think about, because it is obviously not very nice, but it is also means that our amazing, if you're very invested in voluntary degrowth, you don't want to think about it going wrong. I guess as a professional, we always have to think about what could go wrong and what is our mitigation plan for if that happens. Flip this to healthcare. So, right, healthcare is modern healthcare is a child of growth. Okay, all of that stuff, everything we've come to bear. Most of our technologies, really, so many of them are post-Second World War, if you kind of include antibiotics, kind of just about on the cusp kind of thing. So it's much of what we do now has happened in this post-war growth area. So it's going to be challenging, weaning ourselves off that, but it's also going to have opportunities. But we also have to be real about the fact, even on a kind of steady state or degrowth trajectory, we would be on that trajectory because resources are scarce. And again, this is an argument I have with people. There is an idea that all scarcity is artificial and we just need the right sort of social system and everything will be fine. No, if we have actual ecological planetary boundaries, those are real scarcities. So we need to be working with that. And healthcare is no stranger to that. So here's a little story, which is a lovely kind of example. Not lovely is the wrong word, but it's a great example of how these things work. So this is a Quillara saponaria tree, a Chilean soapbark tree. So I don't know why, but somebody discovered many years ago that the bark of Quillara saponaria you can extract from that bark a compound which is a fantastic component for vaccine adjuvants, and it has been used in vaccine adjuvants for decades. And particular kinds of vaccines it's particularly helpful for. There was a big barney a few years ago because there wasn't enough Chilean soap bark, and GlaxoSmithKline had to choose between, did they use the Quillara saponaria adjuvants for high-income country targeted RSV and shingles vaccines, or for a pipeline of malaria and TB vaccines for use in low-income countries. Any guesses which one they chose? Shingles, yay! So real scarcity. There literally was not enough of this, whatever is the kind of extract from the soap bark to make these adjuvants. But at the same time, Calaria saponaria, it kind of grows in a small is probably not the right word, but a limited area of Chile, and it is under increasing threat. So the locals chop it down for firewood. Chile has been experiencing years of extreme droughts, which is massively increasing the frequency and scale of forest fires in Chile. Indeed, in my theme that I'm lead, we've got 2 Chileans who've come to work with us on bushfires because we've got a big kind of bushfire specialty. So actually, Calaria saponaria is likely to become more scarce, not less scarce. And what will that mean for all the, they are trying to find artificial substitutes, of course, but this is, I just think, it's a nice little example of how many of these forces are going to interact in the future. The big challenges in a post-growth world for healthcare, got lots of challenges. We've got the same challenge we already have we have an aging population going to need more care, but also an aging workforce, and that demographic shift of kind of workforce to care needs increasingly coming out of whack. Anything which is remotely private sector requires anything which is for profit is going to require lots of thought and lots of change to make it work in a post-growth world. And I actually think healthcare, and when I say medicine, I'm not fingering only doctors, but like the culture of healthcare is all about doing more things and more technologies. If you once you get to my age, it's pretty extraordinary that when I was a kid at school, several of my friends' fathers keeled over with heart attacks in their early 50s, and a couple of them died. That's pretty unthinkable now, isn't it? Because of all the advances we've made. So how do we culturally deal with limits, etc., is really, really difficult, all the while we're doing lots of change to our infrastructure, etc. But we've also got a load of opportunities too. Dealing with many of these ecological crises immediately has lots of co-benefits. We all understand the incredible air pollution co-benefits. Once we start decarbonising things, we have massive improvements in air pollution. We had this, so much non-communicable disease is caused by various forms of overconsumption of everything from sugar-sweetened beverages to online gambling, you name it, but there's all kinds of health harms from stuff which we could start winding back. We really have to get to grips with all of our manifestations of overuse in healthcare, overdiagnosis, overtreatment, etc. So if we fronted up to this crisis, we could actually do a lot that would have a lot of very direct impacts on improving people's health. So how can we get into that kind of virtuous circle? So this, I won't dwell because I know we need to move on. And yeah, how can we really move beyond overconsumption to a culture of sufficiency? And what does that mean? Here's back to the donut. I'm going to skip through these, just on to kind of degrowth. So an interesting thing degrowth is beginning. There's only probably 7 or 8 of us who've actually published anything about degrowth and healthcare in the published literature. It's a very small field. So a co-author of mine, Jean-Louis Taillon, is part of a piece that kind of suggested these principles for how to apply degrowth to healthcare systems. So firstly, we have to redistribute resources in the health system, and that's particularly about kind of redistributing, particularly very tertiary, ultra-specialized, etc. How can we redistribute that downwards? Secondly, how can we relocalize healthcare? How can we shift things closer to people? How can we reduce overconsumption in the ways I talked about? But also, how can we revive or recycles, kind of a funny word, but kind of reviving alternative medical knowledge, so kind of indigenous traditional medicine, and also really just kind of self-care kind of approaches within the family. So they're kind of principles that are fairly uncontroversial within the degrowth movement. I think they overlap with quite a lot of what is also going wrong culturally in healthcare. So we do have this idea, which I think probably is familiar to people, that what's going wrong in healthcare now is not just about resources and things, isn't it? Particularly since COVID, but not by no means because of COVID. We have a kind of moral, cultural crisis amongst healthcare workers where we're trying to push our systems through a kind of machine system of kind of machine logic, which is pushing out human level caring. And that's really part of our deeper problem here. And actually that industrialized healthcare model is actually harming health professionals as much as it is harming patients. So how can we bring that together? That sort of sits neatly with the degrowth principles. That's too complicated for us to talk about. There's lots of words there, but I'll try and make sure you can have access to these slides. This big long list just tries to sort of pose competing visions and concepts. And really, the right-hand side is kind of modernity industrialized, whereas the left-hand side is not modern, but is more perhaps kind of culture and tradition, shall we say. And I think that's the kind of big question that we need to be thinking about culturally within healthcare systems. There's lots to do in financing. I mean, bluntly, if your economy is not growing, does raise a whole load of questions for both public and private financing of healthcare, and they're questions that won't go away. So that's a hugely urgent area for more research in how we would make that work. I mentioned already, I'm skeptical about how today's for-profit kind of big corporations and healthcare corporations would be able to operate. I'm actually pretty relaxed that smaller scale private for-profit entities could work under kind of non-growth conditions, but kind of big shareholder value, et cetera, financialization, et cetera, that's not going to work. So what kind of change is going to be needed? All of that stuff versus the problem that some of what we need, like pharmaceutical manufacturing, is not going to work well if we try to push it down to your local apothecary. We're probably not going to do well on our, your chemotherapy drugs that way. So how do we keep big, complex industry in a very different organizational structure? And then, scale and complexity is really where we get to that underlies so much of this. I will stop with these. There's more slides, but I'll stop here, which is really, this is where we ended this chapter in the degrowth handbook, which is about what are we saying? So first of all, stop making things worse. And I will show you two here. One way of stopping making things worse is obviously ecological. But in the last few years, we've actually seen an awful lot of healthcare infrastructure destroyed in armed conflict in different places, and a lot of healthcare professionals deliberately or slightly less deliberately targeted and killed. So that's something we need to really get to grips with. Stop making things worse. There's a whole load of things we can do now which are no regrets actions. Things that would help the healthcare system as it currently is. Lots of the stuff that we know we need to do, but that would help us set things up. We've got this cultural piece. We have to start working on moving towards a culture of sufficiency rather than always more. We need to start really doing, I think, concretely doing national health system assessments, really getting ready for this resilience collapse problem, actually. Where are our big weaknesses? Where are our big risks? Now, COVID and all the supply chain stuff actually triggered a bit of interest in this, but that's perhaps drifted a bit now, but we need to do more. We need to really be thinking about what are we going to do if the wheels fall off. And I actually think there is an argument for establishing what I called institutions of resilience before we get into a crisis. And I think those are things like every country needs, or groups of countries, for smaller countries, needs a kind of state-owned, let's call it pharmaceutical, medical technology utility, not for profit, publicly owned, which has the right to step in and start making anything if supply chains start falling apart. And I think there's also a need for kind of knowledge institution or institutions that can protect the knowledge that we have now so that that doesn't then start falling away. And these, I call these, my idea of this is what we actually need is anti-startups. So this whole model, move fast and break things, has really helped to accelerate us into trouble. What we actually need is, they don't necessarily need to be a university, but probably the closest things we have to these are ancient universities that have been going for 800 years and are still going. That's the kind of thing I would want to set up here, something that you could be confident will still be going in 300 years' time, whatever it might look like then. So, taking far too long with that, but I'll stop there. Thank you all. And then shall I stop sharing?
Yeah, sure. I mean, I think many people might have to step away. Folks in the room, I know we're planning to be here longer, but why don't we take 10 minutes for sort of formalized Q&A for those able to stick around for that. And then we'll take a break, grab some food, and continue our conversation for those wanting to hear. So any questions to get started with? Oh, yes. Yes, Martin, thank you.
I do. Thank you for your presentation. My name is Martin Bunch. I'm from York University, just up the subway line to the north, where we have a group of people that do ecological economics and so on, including a colleague of mine, Peter Victor, who does modeling of no growth, slow growth, degrowth kind of stuff. Using systems dynamics modeling. And I'm wondering if you've ever worked with or know of people that have modeled the healthcare aspect into any of that kind of systems-based model.
Sure. Short answer, I do not know of people who really have done that. So I think, preface that, it is possible that there are people who I don't know about, but I think, the kind of for want of a better ways, I've kind of ecological macroeconomics kind of modeling like that has tended to certainly not particularly include health care as a subsector, often because it's kind of being driven, understandably, it's actually being driven by the kind of natural resource sort of use primarily. But I think it's kind of gaining traction. So I don't, so like the big group in Barcelona, or the collaboration based out of Barcelona are sort of sidling up
Like
to kind of help.
Metro, those.
Yes, that's right. They are kind of, I think they kind of see the need for it, but I'm not quite sure they've sort of sorted out how will they do it yet. But yeah, so I think it's sort of, nobody's quite yet flipped it from, quite reasonably from a macro picture into a kind of sectoral, all right, what does it mean for this? And it's got this, it has the same kind of challenges even that decarbonising healthcare has, which is like what is the sort of fair share of healthcare? Maybe healthcare needs a higher share of ecological resources than online gaming, kind of what is it? How do you get to it? There aren't really kind of objective answers to that. So that's a hugely important area for future work.
Especially if those macroeconomic approaches are trying to see how we can satisfy people's needs. Health is
precisely. Yeah, precisely.
Right.
Yeah. Hi, Annie, lifelong learner. I think culture is probably one of the difficult things to do, and what I'm proposing are drop in the bucket solutions, but it does create a culture if people are thinking, okay, this is wasteful. Is there an easy way that we can fix this little problem? I've noticed in my life interacting with healthcare that I go, why do we need a big thing of antibacterial material when all I needed was the little sliver to go into my ingrown toenail? I know it's like a small thing, but if there's a mechanism to report that and say, hey, can you provide us smaller ones as well, so that if it's a sliver of a small one, it's less waste than a small sliver of a big thing. Again, drop in the bucket stuff, but if there's a place to report that and say, hey, this is an easy fix for this little problem, it could create a tipping point for a culture that says, you know what, we've done all the little things, we need to do big things now. That's my question.
No, absolutely, you're absolutely right. And kind of interestingly, kind of my experience, working kind of more locally with health systems in Australia, is for healthcare professionals, that kind of visible waste that's the thing that really gets people kind of agitated and motivated to work on this stuff. So I agree. Yeah, you're absolutely right. How can we start plugging those little gaps? And then, yes, when we've done all of that, but that was only 20%. That is the threshold of how do we do more structural things. So no, you're 100%.
Can I ask you to reflect a little bit more on the financing challenge?
Yes.
I mean, we know that public financing plays a critical role. The whole agenda for universal health coverage is really about trying to increase the publicly regulated or publicly financed. Can you just reflect on what are the problems and initial thought with a post-growth kind of world?
Yes. Okay. So
Yeah.
So I think so. So let's kind of pull apart, maybe without delving too far into the modern monetary theory kind of end of things. But we have this, on the one hand, I think there is an increasing acceptance, certainly very much in the heterodox world, but even honestly sort of seeping into the mainstream, that actually public finance per se, within reason, is not so much of a problem. We know the government prints the money, so kind of you can do that. The problem is what then often the modern monetary advocates kind of don't major on their own constraint, which is that is all subject to the availability of real resources. And if you have a problem of real resource constraints, if you print too much money, then everything does go wrong and you get inflation and it all goes to bits. So that's the steady state idea here, is how do you bring together what are the material constraints for the economy with still actually having a money finance economy. So I think the big challenge, which you don't exit from in post-growth models, is this population dynamic of aging population, particularly in high. But this is not even high. I mean, this is China, and most middle-income countries now are already moving towards that same dynamic. You don't get round that, and I think the get out of jail card free that degrowthers use, which I'm not averse to, is that we need, as communities and families, unavoidably, we will all end up providing more care for our loved ones, etc., in the community outside of the kind of market formal economy. My kind of concern with that, particularly very instructively, I've been on the board of an aged care provider for the last couple of years when we have a big specialised dementia care unit. And I think there is certain naivety about, in that kind of model of we can just all do it, we'll all do it. Of actually, like, dealing with people with advanced dementia and stuff is unbelievably hard without highly trained personnel, etc., etc. So that's a real hard pinch point, I think, which will be difficult. In the longer term, it will go away. Right. Because we are going to go over the, whenever it is, 2080 or whenever it is, we will go over the peak and be coming down the other side. And a lot of those problems will go away. But that will be a very pressing and difficult challenge for, the kind of period we all will be planning for or needing care ourselves in. Yeah, so that, I think that's the big one on
Right, well, maybe we'll dig into that problem at a later time. I'm going to suggest, just in the interest of everybody's time, we can continue the conversation here, but I'm going to formally end the seminar at this point. Thank everybody for attending. Thank very much my co-hosts at the Data Institute and the Institute for Inclusive Economies. Thanks very much, Martin, for fostering such interesting discussion and sharing these thoughts with us. And we hope to continue the conversation with many of you going forwards. Take care.